Good afternoon, everyone. Thank you for joining today. My name is Letty Perez, and I am the broker account executive here for the team at North American Insurance Services. Want to give you a little bit of background on Pivot Health, kind of set up the stage for what you can expect when working with Pivot Health. So Pivot Health is actually not an insurance carrier. We are a product development, marketing, and management company. So we design the products and we bring them to market, but we actually have insurers that insure the plans for us. So we have multiple carriers that insure the short-term medical plans that we offer. We were founded back in 2015. In 2018, we were purchased or acquired by healthcare.com, which is an insure lead tech company. So that is why you will see the healthcare.com logo throughout our website. And also my email domain is going to be healthcare.com and not pivothealth.com. So just a little bit of background. And also you want to make sure that the clients understand when they purchase a plan through you, they don't want to go into a provider or a facility and say that they have Pivot Health insurance, because again, we are not the carrier. They're not going to recognize the name, and they're going to say we're not in network, or they don't have any type of a contract with us. The client's ID cards will clearly state who the carrier is that's insuring the plan that they purchased. So when you log into your Pivot Health agent portal, you are going to see our proprietary product suite, which is going to be, of course, our short-term medical plans. That is what we are known for. Those products are available up to the age of 65. Our dental and vision product is a proprietary product, and it is going to be available as a check the box when selling short-term medical. It's also available as a standalone product, and that dental and vision is available beyond the age of 65 as well. Our supplemental product offered through Communicating for America is a check the box only when purchasing a short-term medical plan. So you will not see it standalone. But keep in mind that if the client purchases the Latitude plan, when they buy their short-term medical plan, they can keep that supplemental plan until they turn 65. It is a separate policy. So what makes the Pivot Health short-term medical plans unique versus other companies in the market? We have a large array of plan options that are bound to fit your client's needs and budgets. We do today offer extended durations. And I say today because this is going to be going away starting on September 1st, as there's been some new administration rulings on short-term medical plans. We do offer today two by 180 day, 2 by 364 day, 3 by 364 day coverage periods. This is not available in every state, so you would need to look at the state availability, or the site will allow you to do the extended durations based on the zip code that you're quoting, so you don't have to memorize it. The advantage of selling these extended duration plans is that there's no additional underwriting in between each coverage period. So they sign up today, they will have multiple policy durations back to back without having to reapply. And that's key because the Pivot Health plans are a simplified underwriting, and there's going to be no new pre-X look back, no new waiting periods, and all the benefits on each policy reset. So deductibles, coinsurance, maximum benefits, everything resets. It's a new policy, new ID number. And keep in mind that the maximum benefit they select on the plan is not a lifetime maximum. So if they selected $1 million total coverage, they used up 800,000 during their first duration, that $1 million will reset with the next policy. Commissions are going to remain level. And on the companion life plans, the premiums are also going to stay level. So whatever you quote them today for that extended duration, that is going to be rate locked. We have preventive and wellness benefits on all the plans. We do have plans that utilize national networks. We are mostly known for open access plans. So these plans allow the client the freedom to go to any doctor or any facility. There's going to be no network restriction. With those plans, we use reference-based pricing. Our plans are, as I mentioned, simplified underwriting. So their eligibility is based on how they can answer the application questions. If they can answer no to all the questions, they will automatically be issued. There's no rate up, so you're going to see there's no tobacco use question. We also do not have a height and weight chart. There's only going to be a limit based on weight. So a female cannot be over 250 pounds, a male cannot be over 300 pounds. We do accept controlled hypertension. We accept controlled diabetes by diet and exercise only. So if any type of insulin or oral or injectable medication for diabetes is a knockout. They would not be eligible. We do not require a social security number. So if the client is not a U.S. citizen, they only have to be able to answer that they have resided in the United States for the prior 4 months. That applies to the North River and the companion life plans. Our newest plan, SureCare, which is underwritten by Pan American, does require that the non-U.S. citizen have resided in the U.S. for the prior 12 months. With the open access plans, the clients have access to a patient advocacy service called Point Health. They can reach out to Point Health and have them assist in finding providers and facilities in their area for the specific services they need that would work best with the plan. Make sure the client understands that service is free to them. There's going to be no charge for them to utilize those services. And also, they do offer bill negotiation services. So for those larger bills that they may be responsible for, they can also reach out to Point Health and get assistance with negotiating those bills down. Also, Pivot's known for designing products for certain niche markets. So for example, we cover student athletes. So high school and college athletes are covered on our plans. And so yes, an injury incurred while practicing or playing in a collegiate sport would be covered. Child only policies on the North River and companion life plans. Child can be as young as 6 months of age and be on a policy by themselves. Or if you're putting multiple children, the youngest cannot be under the age of 6 months. If you have a child under the age of 6 months, they would be able to have coverage, but they would need to be included with an adult. The new plan, the short care plan, does require that the child only be as young as 1 year of age. Again, a child under the age of 1 could have coverage, but would need to be included with an adult. Still till today, our largest market segment here at Pivot is that pre-Medicare market. So that 60 to 64 and 11 months of age, because these plans are going to be so much more affordable for that younger person in that age band. I'm sorry, for that person in that age band that's a healthy person versus an ACA or an marketplace plan. All of the plans include free and unlimited telemedicine that they have access to. And all of the plans are insured by A-rated carriers. Keeping in mind again, Pivot is not the carrier. So when you go into the Pivot portal, these are going to be the different categories of plans you're going to find. Core plans underwritten by Companion Life Insurance Company. The classic plans are also underwritten by Companion Life. The name of the classic plans would be Choice Deluxe, Standard, and Economy. Epic plans will have two different plan designs. One is going to be a PPO plan, one is an open access plan. Our quantum plans are true PPO plans that utilize a Cigna network. And just so you know, these plans, the quantum plans, are not going to be available in states like Texas or Georgia. The short care plan is the newest plan that we rolled out in April. So this made carrier number 3 on our portfolio. These plans are only going to be available for a 6-month duration. So just a couple of highlight benefits on core plans. Again, core plans underwritten by Companion Life Insurance Company. These are what we call a light short-term medical plan because there are some benefit limitations that I'll go over. They're also known as a passive PPO plan. So a client on a core plan has access to utilize a First Health Network provider, but they're not limited to using that network. They can go to any doctor or any facility, and it would be treated as an open access plan. With that said, these plans look very attractive: low deductibles, low coinsurance, max out of pockets, $750,000 total coverage. You have prescription coverage, a discount on the Core 1000. The Core 2000 has prescription coverage with no RX deductible and co-pays that kick in immediately. So this is how all of any plan that I go over that has the RX coverage with co-pays, they're all going to work the same. So no RX deductibles, co-pays start immediately, but there is going to be a benefit maximum on those RX coverages. So what the carrier pays out for those medications, if they're on a 6-month plan, it's going to cap out at $1,000. If the plan goes up to 364 days, the RX benefit will max out at $2,000. These core plans offer office visit copays, $30 for a primary doctor, $60 for an urgent care or a specialty doctor. These are limited to 3 visits per insured per coverage period combined. It is not 3 in each category of office visit copays. Now, also make note that these are not for wellness or routine visits. These are for sick visits only. I mentioned that we call these the light short-term medical plans, and these are the only plans that work this way. So even after the client satisfies deductible and coinsurance, there is a limit on how much the plan will cover for hospitalization benefits. So for example, if the client is confined to a hospital, the maximum that the plan will cover would be $1,000 per day. Anything billed over that $1,000 is going to be the client's responsibility. So you want to make sure the client understands those limitations within. For this reason, the majority of the clients we see on core plans are going to be that younger age band. So under the age of 25, a lot of child or children only policies. But now there are agents that do sell them to those older age bands. But of course, then they normally will bundle them with some type of hospital indemnity or fixed benefit plan that will give them some coverage for that out-of-pocket exposure. So just make sure that the client is aware of that. There is a preventive examination benefit on these plans. It will pay up to $200. That is going to go towards a wellness or preventive visit with the primary doctor for an adult. So make sure that they understand it does not apply to routine child visits. As we know, children go to pediatric visits on a regular basis during the first couple of years. That is a separate benefit. Same for a female. Her OBG annual examination is not going to fall under that preventive or wellness with that $200 benefit. It is going to be subject to the deductible and the coinsurance. And the reason I go over that is I've had agents reach out and explain and tell me that their client uses their OBG as their annual wellness checkup. It is a different benefit. The classic plans, as I mentioned, also underwritten by Companion Life Insurance Company. So again, if you offer an extended duration up until the end of this month, these are going to have rate locks. Same for the core plans. If you do the extended duration, if it's available in the state that you're quoting. So these plans are all open access plans, no network. So there's not going to be an option to use the First Health Network like the core plans. So keep in mind, these are the plans that are going to offer the largest array of plan options. You have deductibles ranging from $1,000 up to $10,000. You have maximum benefits ranging from $100,000 to $1 million. We have 2 plans that offer office visit copays. These are those sick visits. And again, limited to 3 visits per insured per coverage period combined. That would be a choice plan or a deluxe plan. All of the plans offer a wellness or preventive visit that'll cover up to $200 for that visit. And Again, it is for that one wellness or routine with the primary doctor. And as you see here, lots of different benefits available on these plans. If the client is looking for coverage with the RX benefits with the copays, you'd want to offer them a standard or a deluxe plan. The other plans will only offer a discount card for prescriptions. So you see here, there are lots of different benefits. The Epic plans, these are the only plans underwritten by North River Insurance Company. We've got two plan designs. There is a PPO plan that utilizes a Cigna network. Very important that they note if they select to be on a Epic PPO plan, they do need to stay in network whenever possible. If not, their benefits will reduce or they'll lose some benefits. Epic Base Plan, complete open access plan, no network restrictions whatsoever. And with these plans, they are 100% coinsurance plans. So once they satisfy the deductible they selected, that would be their max out of pocket. These plans do include a wellness or preventive, again, for that primary doctor visit. There is going to be a 3-month waiting period on Epic to use that benefit, and it pays up to $100 towards that benefit, that service. When you are offering Epic plans, you are going to see that there is an option to add on a supplemental accident rider. Must be selected at the time of enrollment. If they don't select it, we cannot go back and add it on. If they selected it in error, you would have to cancel and remove it. We cannot remove it from an existing policy. The benefit selection is 5,000 or 10,000. That is going to cover any expenses incurred if the insured was injured in a covered accident and required medical attention within 72 hours. You're also going to notice that when you select the Epic plans, they're going to be listed twice on the platform, and that's because the first option will not include RX coverage. The second option will include RX coverage with copays. And again, it works just like I explained earlier with the limitations based on the duration of the plan they purchased. So just a reminder, the Epic PPO uses that Cigna network. The Epic Base is an open access plan, and we use reference-based pricing. The Shore Care plans that we've rolled out in April, these are underwritten by Pan American. So this is the third carrier that we have to offer. These are they're now available in about 20 or 22 states. It is only going to be available for a 6-month duration. So when you go to quote, it is not a mistake. You will not have an option to make it for a longer duration. These are going to be open access plans, no networks. So they have the flexibility to go to any doctor, any facility. They do get those unlimited office visit copays. There is not going to be any prescription coverage on these plans, just a discount card. And also, you want to make sure that the client understands that if they are going to enroll in this plan, a baby cannot be under the age of 12 months. If they are not a U.S. citizen, they have to have resided in the U.S. for the prior 12 months, not 4 months like the other companies. And these plans, of course, are going to use reference-based pricing. So reference-based pricing, for those of you who are not familiar with what that is, it's how Pivot Health pays covered claims. So for any of the open access plans, Pivot will pay providers up to 125% of Medicare allowable or usual and customary for covered services. For a facility, it will pay up to 150% of Medicare allowable or usual and customary. This affords the client a very large discount versus the retail charges, about a 69% savings. The claims should be submitted by the provider or the facility. That will allow us to do the proper discounting. Their EOB will show what was billed, the amount that was deducted or discounted, and then what they are responsible for. Should they receive a balance bill from the provider or the facility due to the discount we took, they have the right to send that in to us, and we will settle out that bill on their behalf. Again, just a reminder that patient advocacy service, Point Health, they have access on the open access plans, help with provider navigation, and also the bill negotiation services free of charge. No provider access fee allows the premiums on the open access plans to be more competitively priced because when we use a network, there is a PPO access network fee that is charged to us that gets passed on to the member. The Cigna network is available again on the Epic PPO and also the quantum plans that I'm going to go over. First Health is available as an option on that core plan with the limited hospitalization benefits. The quantum plans are the last plans offered by Companion Life Insurance Company. Again, so these would have a rate lock if you do the extended duration while you can. Two different plan designs, Epic PPO high deductible, Epic PPO copay plan. Again, make sure that they stay in network whenever possible in order to maximize the benefits on the plan. The max out of pockets on the quantum plans is always going to be $10,000. It does include the deductible. If they select the quantum PPO copay plan, they will get those office visit copays for those sick visits included. They'll also get the prescription coverage with the copays included. Both plans do offer that preventive or wellness visit per insured per coverage period. It will cover up to $250 towards that visit. Also, another rich benefit included on the quantum plans, it includes a supplemental accident benefit, not a rider that needs to be selected like on the Epic plan. It will cover up to the plan deductible for expenses incurred if the insured is injured in a covered accident and requires medical attention within 72 hours. For the ancillary products, the Brilliant Dental will pop up as an add-on when you are offering a short-term medical plan. This is a proprietary product insured by Renaissance. It is a PPO plan. The age eligibility is 18 and up. When I say up, that means that there is no maximum age. So if you're working with a client that's over the age of 65, you can offer them the Brilliant Dental plan. If they are under the age, if the client is under the age of 18, it will not appear as an option to add on to the short-term medical. If you're selling it as a standalone product, again, if you put the date of birth in and the client comes up under the age of 18, it will not allow you to proceed. If the client has children under the age of 18, they can be included on the plan with the adult and get all the benefits. If you are including children, I would recommend that you do the maximum plan, as that's the only one that includes child ortho benefits. So make sure that they are aware of that. The value plan is a basic coverage only, and it does have a 6-month waiting period. Your essential and maximum plans do not have any waiting periods. It includes major services, and the benefits are progressive. So they increase from year 1 to year 3 and then stay level. Routine cleanings are paid at 100% on these plans. Also, you can add on a vision coverage through Vision Care, and it is only available when purchasing the dental. It is not available standalone. The Latitude plan is that supplemental product I mentioned. It's offered through Communicating for America. You will only see it when selling a short-term medical plan where you can click and do a check the box and add it on as an additional coverage for them. This is a bundled product: accident, critical illness, hospital indemnity, and accidental death and dismemberment. The Select plan offers a $2,500 benefit. The Preferred plan offers a $5,000 benefit. Nice thing is these cash payments are made directly to the member, and it pays out regardless of any other insurance. So there's no coordination of benefits. They can use this plan alongside of their short-term or any other coverage. Because keep in mind, when the short-term plan expires or they cancel it, so long as they have not turned 65, they can continue to pay for their Latitude plan and utilize those benefits. They're also going to get some non-insurance benefits included because this is offered through an association. So super important. What is going on today with short-term medical duration? So the current administration has put into law starting September 1st Short-term medical plans will not be able to be in force for longer than a total of 4 months. So the way the law was written, it's 3 months plus a 30-day extension allowed per carrier within a 12-month period. So this is one of the reasons why I was stressing so much that Pivot is not a carrier. We are a marketing company. So we do have 3 carriers to offer those 4-month coverage periods for short term for your clients after September 1st. They also required some new disclosures as they want to make sure that clients understand what they're purchasing if they opt to buy a short term medical plan versus an ACA plan. The nice thing is, right now, business sold through August 30th with an 8/31 latest effective date with the current durations available will be grandfathered in. So if you can sell a 3-year plan before August 31st, the client will be able to keep that coverage and ride out all the coverage periods. It will not be canceled out on them. They are going to be grandfathered in. So again, what does this mean for the consumer? They're going to be limited to 4 months. If they want to stay on short-term medical plans, they would have to go ahead and reapply for another coverage period. They have to make sure that they select a different carrier, as they're not allowed to repeat the same insurer over a 12-month period. And what we're advising agents, as I was just mentioning, write the longest duration plans now. If we have clients that have been on short-term medical plans for years, they're happy with the services, with the benefits, and want to stay on it, do not want to move over to an ACA plan. So do this now. Our site will allow you up through 8/30 to put in for an effective date of 8/31 with the durations that currently exist. But Pivot Health, again, we are always looking for solutions for our agents. So we do have, again, those 3 different carriers to offer those 4-month durations, because we are just going to go ahead and assume the maximum duration of 4 months, assuming that most clients would want the longest duration possible. Keep in mind that the cancellation rules are the same as they are today. They can cancel at any time with no penalty. So they don't lose anything, and any refund that may be due would be prorated if they cancel in the middle of a month. So by staying with Pivot, you have your book of business, you're able to manage your clients and what carriers they're on. It's a one-stop shopping for quoting and enrolling all 3 carriers rather than going from different companies, your Allstate or your UHC to come to Pivot. Same commission schedule, same services, and I remain your broker account executive. Big announcement we did recently, Pivot's 1312 solution. So we have designed one enrollment with 3 different carriers, one set of eligibility questions, one enrollment fee, insurance carriers, 3 different carriers to offer. It's going to be a bundle, 4 months with each carrier with this one application, offering the client a total of 12 months of coverage. Kind of works like the way the extended duration. One policy ends, next one starts automatically. No break in coverage, no new application or no new underwriting, and no new pre-ex look back. So we're super excited to announce this. So the way it's going to work, you've got the 3 unique insurance carriers as issuers. The carrier sequence will be randomized. The site is also going to ask the client if they've had prior coverage with one of the carriers, because then the site will make sure to put that carrier, if they had previous coverage, to put that carrier in the last slot of their 12-month coverage. So they stay within the law. They are not repeating coverage within that 12-month period with the same carrier. So 3 separate policies, but they're going to have one enrollment, no new underwriting, no new waiting periods, and no new pre-ex look back. So the plans are not going to be identical because they are being offered through 3 different carriers. So they will need to download ID cards and review what the benefits will look like with each new coverage period. The rates will vary with each coverage period, but the nice thing is when you go to start quoting these on August 31st, the site will be updated. You'll have either the 4-month option or the 12-month option, which will be the bundle where available. And you will be able to see, based on the order of the plans, what each of the plan designs looks like and what the premium is going to be for that coverage period. And they are also going to be required to do an e-signature. So the agent cannot sign off for the client any longer. Just want to make sure that everyone's clear. If you are working in the Pivot Agent portal today and you put in an effective date, September 1 or all the way out to January 1st of 2025, the only options you will see will be the North River Epic plans. They're the only carrier that allowed us to go ahead now and put in effective dates for further out after the September 1 change. So if you are offering a companion life or shore care plan, you'd need to submit that application by August 30th with the latest effective date of 8/31. So make sure that you see that. Obviously, if you're in a state where North River is not available, if you put in the 9/1 effective date, it is not going to display any plan options. All the plans will still be in existence after September 1st, but keep in mind they will all be reduced down to a 4-month total coverage period. And make sure, if you do sign a client up prior to for a later effective date after September 1 through January 1st, they are going to get charged immediately for their first 30 days of premium, as we do with all the plans today. I'm going to go ahead and leave this screen up and see if there are any questions that I can answer. Feel free to put them into the Q&A or the chat box. I am not seeing any questions or comments in here. I want to thank everyone again for the opportunity to present. Feel free to reach out to me directly, and I will be more than happy to assist with any questions you may have. Thank you again.